Hello, I'm Dr. Stokes. Welcome to the channel. Today I want to give a master class on magnetic therapy. I had some calls this weekend. People were asking me, again, how do they get started and how does it work? I thought I'd make a quick video explaining to you how to do magnetic therapy in just 5 steps. And the first step, which may seem very obvious, is you got to buy a magnet. On my website, I have a link to my Amazon store where I've got the best magnets that I've used. They're there. You can buy them. You support the channel when you use those links. And a lot of times you actually get them cheaper than if you buy them directly from the manufacturer, which is strange. But first step is buy yourself a magnet. You can buy a magnet like this, which is a ceramic block magnet. They're very heavy. They're not really powerful, but back 20 years ago, these are the magnets that I used, and they do work very well. You can buy a bar magnet that looks like this. These are some old ones that I've had these for almost 20 years. And you can see that it's a bar magnet, and it's got a plastic case. This case is cracked around it. And those are also very good. Or you can buy neodymium magnets that are encased in a cover like this. This is something that I use a lot. It's a pillow magnet. So you put this in your pillowcase and you rest your head against it, and of course you get to use it all night long while you're sleeping. This is very effective. By the way, these neodymium magnets like you have in this are way stronger than the bar magnets, right? Way, way stronger. And I have other videos that explain how magnets are rated and more of a scientific breakdown of how that works. But basically neodymium is going to be in some cases 10, 20 times stronger than a ceramic block magnet. So nowadays I use these neodymium magnets more, and my favorite one is it's one that is titled, I think it's titled low back, hip, and abdomen, and it's a nice square with neodymium magnets. It's soft, right? And you can strap it to different parts of the body that you want to use. And you have to remember also that with the magnets we're talking about, magnets produce a field, and any person or anything in that field is going to be affected by the magnetic forces. And so what's great about magnets is it doesn't have to be as specific as you think, right? You can apply the magnet to an area, and because you're getting a field, that area is going to be influenced. And these magnets that we're talking about here will penetrate over 12 inches into the human body. So there's not really anything you can't get to. For example, if you apply a magnet to your head, even though you have a skull, the magnetic field is going to go through that skull, and it's going to penetrate into those deeper structures in the head. Very effective when you're trying to understand how to apply the force, right? This is number 2 now we're going to talk about, which is how do magnets work? Nobody really knows. How's that for a quick answer? But what I have found clinically is that using the north pole of the magnet is the most beneficial field for the influence that we want to do in healing and all positive types of things. So we use the north pole. You're going to use the north pole 99.99% of the time. You're going to use the North Pole with good results so much that I would like you to just forget about the South Pole. Just use North Pole on everything. That's going to produce the type of effect that you want to get. And the amount of time that I use, the duration, is between 12 and 20 minutes per treatment. And that, again, is just my own clinical experience. I always state in these videos, I'm not a scientist. I'm a clinician. So I'm telling you things that I have seen work. When I say 12 to 20 minutes, and then if some scientist gets on and says it's 15 minutes or it's 22 minutes, that's fine. My experience has been at least 12 minutes to get a result. In other words, at least 12 minutes to feel a change. And at about 20 minutes, I have found over the years that the benefits peak and then they begin to decline after that. So 12 to 20 minutes is going to be the range of the treatment that you're going to want to use. And again, you're going to take the magnet, you're going to put it close to either the part of the body you want to influence or the object you want to influence. Object? Yes, object. So for example, If I want to influence my gallbladder, I will take this ceramic block magnet. I will take the north field. This is marked with an N underneath here. So I'll take the north pole of this magnet and I'll place it in the general area of my gallbladder like this. And I will treat that for 12 minutes or up to 20 minutes, right? And I may do several treatments a day. That's how it works. If I want to influence something like this, if I want to influence a liquid, I'll put that liquid on the bar magnet, again, for 12 to 20 minutes, and I may meditate over that. I may do other things to try and influence the field, but basically this is how I'm going to treat something that is, something like a tincture or a glass of water or an object as well, right? So if I want to take an object like this beautiful gem ring that I have, I may take this and I will put this again on that north polarity of the magnet for 12 to 20 minutes to affect the field of that object. That's how it works. The next thing I want to talk about, which is arguably the most important thing you need to know, is the dangers. You cannot put a person into a magnetic field that has an electrical device that they're relying on. So if you have somebody with a pacemaker, you don't want to put them in a magnetic field. Pacemaker, implants, hearing implants, brain implants, right? All sorts of electrical devices or implants that the person has, that's a contraindication in magnetic therapy. You don't want to do it. If you aren't sure what that means, then just look up an MRI and see what the rules are before you go in an MRI. And there'll be a list, right? When you go to an MRI facility, they have a list, right? They want you to remove earrings, no metal. There's a big warning sign, right? Warning, you can't do this if you have a pacemaker, etc., etc. So be aware that the magnetic field is going to have an effect on electrical devices. We don't want to treat patients with electrical devices that they're relying on because it can damage the electrical device. Makes sense, right? Other than that, if you keep yourself focused on the north polarity and the 12 to 20 minutes, you should not have many problems. A lot of times people will ask me, is it safe to use a magnet if I have, say, a knee replacement? My experience has been that it is safe to use that. I have used a magnetic field on knees that have been replaced, hip replacements, a lot of these things. I have used magnetic fields on those, and I've had no problems as long as there's not an electrical device running, that area. Then I find that it's okay. But if you've had surgery and you have, rods in your back and screws and stuff, then I'm going to say you need to check with your physician before using magnets. I'm only saying that in my circumstance, I have used magnetic field therapy in those cases with good results. You will have to make your own decisions. That's very important, right? Okay, number 4 is I want you to understand the anatomy of whatever you're treating. So go and get yourself on Amazon an inexpensive book of anatomy if you don't understand anatomy. Find out where stuff is in the body so that if you're going to treat a structure in your body, you know where it is, right? Figure out where the heart is. Figure out where the liver is, right? Figure out the parts of the brain and what they influence. Figure out where, the certain nerves are that you're trying to influence. So again, understand where the bowels are, right? Where's the bladder? Well, if you look at an anatomy book, you're going to find out that the bladder is not here, right? The bladder is down here. That's good enough, right? You just need to know the general area. So if you're going to do a treatment for the bladder with your north polarity, you don't want to necessarily put it up here. You want to put it down here. How do you know where to put it? Reference your anatomy book. Just get a cheap anatomy book, understand human anatomy, understand human physiology, even on a basic level, and you're going to get better results, right? Understand, for example, that the kidneys are back here below the ribs and that the kidneys influence filtration, they influence the adrenals, right? They influence adrenaline in the body, stress, hormones. Get a basic idea of what does what and where it's located to help guide your magnetic therapy. Also, if you're treating an object, for example, that's, again, something you're going to want to know the anatomy of the object, right? Understand what this object is made up of, understand how. For example, if I'm treating this is ashwagandha. This is an herbal remedy that I use quite a bit in practice. If I want to influence this, then I should understand, for example, that this is glass. I should understand that there's no metal in this. I should understand what's inside of it. What is it supposed to do? So I understand, for example, that glass is pretty non-influencing. It's not going to influence this at all. If this was in a metal cup, it would be influenced a lot more. So the glass is pretty inert. And then I have to understand what the liquid is. It's ashwagandha. What does ashwagandha do? I should know what that does before I decide to influence it with a magnetic field, right? So if I know that ashwagandha is good for stress, for example, then when I place it in the magnetic field, I'm looking to increase the effects of ashwagandha for stress, as an example. And that intention is going to be amplified with the magnetic field. When I enter that magnetic field with my intention of knowing what this does, then I can amplify how this will work in myself and in other people. That's what's amazing about magnetic fields. You know, I just want to say that there have been many studies done, and we know, for example, that the heart gives off a magnetic field, and it can be registered. And that magnetic field of the heart projects, and it can be measured 3 feet away from the body. So your heart is producing a magnetic field up to 3 feet. Then you've got magnets producing a magnetic field. These fields cross, these fields influence each other. And it's very easy to understand how, for example, if I take ashwagandha, put it on a north polarity field, and have this within 3 feet of my body, and if I do some heart-focused breathing, and if I want to influence this and make it even more powerful, all I have to do, right, is send my intentions from my heart into that field, cross the fields, and it's going to get affected. In theory, I could just take this tincture, and now I have it in this field. I can bring this field within 3 feet of my body, and this is going to influence my own heart magnetic field. That may seem a little bit too far out for a lot of viewers. That's okay. If it is, just ignore that part of the equation and just think of it more on a practical level. When you use the magnet, you have to understand the anatomy. And finally, the fifth thing that I want to stress in my master class of how to use magnets, right, is that you need to record results. So if you are experimenting and you're using magnets for something, so if I use a magnet and I'm trying to influence a gallbladder, for example, or I'm trying to reduce pain in a leg, I have to make a note. My note would be as follows. Used this, the type of magnet, the amount of power the magnet has, the duration of the treatment, 12 minutes, where I placed the magnet, how I felt before, how I felt after. And you have to record that with the date and the time. If you record and log your treatments, they will improve. How do they improve? Well, obviously, first of all, they're going to improve because if you don't get results, you're going to see that and you can make changes to placement, changes to duration, right? Changes to strength of the field. So it makes sense. But also, back on this intention idea, if I'm documenting those treatments, right, I'm building intention. So all of a sudden, after I've had 5 treatments on my knee with a North Pole magnet, and I go to write the 6th one down, I have a record of that, and I'm working my own intention. I'm intending that to get better. I'm expecting that to get better. And that intention is being projected out of my field, and it's being crossed into the field of the magnet. So there's a blending of these fields. It's going to intensify the treatment. You're going to get better results. So make sure you keep records as well. And that's it. 5 steps. Everything you need to know about magnetic therapy. Guys, it's that easy. It's that simple. Don't complicate it. You don't need to spend hundreds of dollars on magnets. You don't need to spend hundreds of dollars on courses with all of this technicality, specific stuff. You don't need it. I'm telling you. It's a generalized type of treatment. It's just about getting in the field, and the most important thing is your intentions. And some people say, well, that's just a placebo. It's not a placebo. If you take a magnet, if I take these magnets that I have right here as an example, and I hold them so that I have north and north, and I try to push it together, there's a force between those magnets, right? If I turn it around, you'll see it a bit more clearly. Get my fingers so I don't get my fingers hurt. There's a force here. This is a real force, right? This is not a placebo. This is doing something. And so, yeah, it's not a placebo effect, but here's the thing. If you're one of those placebo people, fine. Consider the placebo effect. Who cares? Placebo effect to me is the greatest medicine of all. If you can determine a way to trick your own system to heal better, and if that's placebo, man, that's what I want. We should all be doing placebo effect. The idea that the body has an innate ability to heal and we can influence that by thought, that's the strongest medicine I know. So again, good luck with your magnet therapy. If you have any other questions, you can reach out to me through my website, or you can even reach out to me here in the comments section of this video. I'll leave some links as well if you're looking at buying some magnets. Please subscribe, and I'll see you again in a few days. Bye-bye.